We'll call the meeting to order. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
We're not on.
Approval of the agenda. Any additions or corrections to the agenda?
None. Move to approve the agenda.
I'll second.
All in favor?
Aye.
Opposed? Okay, minutes from last week?
Make a motion to approve the minutes from last week?
Second?
Any corrections or additions to that? All in favor?
Aye.
Opposed? And we will start with our public comment period, and again, a reminder, no personal attacks are allowed or anything referring to litigation. Anybody want to talk? I bet Shirley does. Good morning.
Good morning. Shirley Johnson, President of the Houston County Historical Society. Houston County does not have a great many buildings.
Shirley, why don't you have a seat right up in front so you're close to the microphone?
Okay.
The back door has.
I'm here for a little statement from the Historical Society on the...
Can't hear a word you say with the door closed. Or open it.
Sorry. Can you hear me?
Yes.
Houston County doesn't have a great many buildings or places on the National Register. At present, there are 12 buildings, one bridge, the Yucatan Fort site, plus a historic district, the 101, 204 East Main, and 101, 108 South Kingston in Caledonia historic site. Two places have been torn down, the Poor Farm and the Stone Barn in Eitzen. The stone bridge over Riceburg Creek is in the process of being eliminated. The Society owns the Christian Bundy Jr. Stone store in Eitzen. After tuck pointing through a grant from the Minnesota Historical Society, the maintenance has been low, mainly a roof and occasional window. It is the hope of the Houston County Historical Society that all avenues will be pursued to preserve this very unique Houston County historic jail for present and future generations, either public or private, to enjoy.
Anyone else wish to address the board? All right, moving ahead, Darlene, you can get in a little early here.
I'm here seeking approval from the county board to proceed with a RFP for the court-appointed attorney contract. I have some information if you're interested in it, otherwise, past year's expenses and things like that. But we've done this now for about 10 years. I think it's a good way to save money, streamline, whatever, and so I'm hoping that you will allow me to proceed on that. If you have questions, I'll try to answer.
What exactly are you doing?
People can apply for court-appointed attorneys in certain actions. That would be civil commitment, paternity actions, CHIPS cases and appeals and whatnot, things like that. It's nothing to do with the public defender. That's a state system. But the county is obligated to provide and pay for attorneys for those individuals if they qualify financially. And years ago, we used to do that on a rotation basis. We'd have a list of attorneys, and we just go through and appoint, based off that list and who was available. About 10 years ago, we decided to try to save money and do this contract. We did save money, I think, in the end, but you don't know, after so long, you don't know if you're really saving money, because when you're under a contract, of course, they want to keep their time down. I mean, they're not, if you're going to pay them $100 an hour and I give you a case, I can stretch that case out versus you're only getting $4,000, and so I'm gonna try to be very efficient and get this work done efficiently, not that they're unethical or building up their bills, but, that's the nature of the work, I guess. Just as a FYI, I thought this would be pertinent for you to know. In 2011, right now, the court-appointed attorney contract rate, if we didn't have, the court-appointed attorney rate without a contract is $100 an hour. Most of the time. It can be up to $125 on certain appeals. In the year 2011, based on the contract that we had in place, we paid $109 an hour. In 2012, we would have paid $107 an hour. In 2013, we would have paid $122 an hour on average. This year, and I anticipate that this will be going down more because of the workload. In 2014, we're averaging $94 an hour. Just as far as case filings, in 2011, we had, with just this very few case types, we had 115 cases. 2012, we had 90. 2013, we only had 77. And already through the end of May this year, we've had 79. So you can see that's stuff that we don't, caseload is not anything we have control over. I can see, we had our lull last year. I see it picking up again with the various case types. I know we got an email yesterday. We got 2 more kids in placement for a CHIPS, new CHIPS petition. We've had a lot of expenses on commitments and things like that. It's been busy that way. So anyway. So what I'm looking for is, I don't know if you need a motion or whatever to approve. So what the RFP would be is I put an ad in the paper saying, come, submit your proposal, and then we'd open the bid up or whatever. And just so you're clear that, let's say if we come back with a bid or a proposal for $200,000, we could turn that down and we could go back to our hourly rate. And the last contract, because it's usually a 2-year cycle, the last contract was down from the year 2011 and 2012. It was the contract in those years was $52,500, and then these last 2 years it's been at $48,000. And then of course we have cases that aren't covered under that contract, so we end up with a little bit more than that.
I'll make the motion that we go ahead with the RFP, right?
Yep.
For
Court-appointed.
court appointment.
I'd second.
Further discussion? All in favor?
Aye.
Opposed?
Thank you.
No, we're running a little bit ahead of time. Why don't we go to the consent agenda next? Correspondence to payroll regarding recent hire and related changes. Number 2, Southern Minnesota Tourism Association funding request. Number 3, correspondence from Money Creek Town Board. And number 4, Section 8 vouchers by county report. I think you all received that in advance.
Are we funding tourism?
We do this year,
Okay.
and yeah, now they're asking for next year's.
Oh,
We'll be
yeah,
talking
okay,
about
so
that during the
nothing new,
budgeting.
nothing more.
Nothing
Okay. Move to approve the consent agenda.
Second.
Further discussion?
Did you guys take time to look at the southeastern Minnesota stuff they sent out? And where we're at as far as tourism jobs in our county? And, we kind of made tourism a priority as our board, and I think that it just goes to show how much more we have to do as a county to get more tourism dollars here.
And as far as the correspondence to Money Creek, I did contact the clerk and 2 of the supervisors addressing their concerns. All right, all in favor of approving the consent agenda?
Aye.
Aye.
Opposed? Unfinished business. Frac sand issue. Justin, you want to update us?
Yeah, we had our meeting yesterday morning. which was cut short because we didn't have, a lot of people had things going on. So we ended up just discussing a few things briefly about some of the maps and setbacks, and then set up a time for next Monday at 8 o'clock. So it's pretty brief.
Seems to work better for most of the people on the committee to start right away instead of breaking up the day between 10 and 12.
Yep.
So. Highway Department building repair costs.
And I think Ryan is coming in, he's got, for next week.
Yeah. HSR.
HSR coming in.
Yep. So I have a presentation next week.
And courthouse and historic jail issues. I noticed we did not get any financial information yet from MCIT.
Unless Jess is bringing
No
it.
answer.
Unless Tess is bringing it in with her report, but at this moment, we don't have anything. We did get information from, I saw Bart Beeson on different websites for historic places. It was very interesting. A lot of people are dealing with the same thing. But right now, we don't have any costs. That's our biggest problem. Okay. Commissioner reports. Dana?
And mine was just the Rexham meeting that we just touched base about.
Right, and I had no meetings. I did take a tour of the Tracy Erickson sand mine.
Yeah, I wanted to check my calendar to see where all I've been. I went to a sheriff's and chief's meeting, and the information from that's coming forward next weekend was Scott's agenda item. And I would hope that you guys all take some time to visit with people at the sheriff's department stuff and to find out what they're talking about. The excitement at that meeting for this program was incredible. I mean, it's something that we really do need in our county, but it's too much for me to explain because I don't understand all the aspects of it. But it would be a good thing to find out more about it before the meeting, because it was really good, and I checked about it. I checked with some other sheriffs at a meeting that I had yesterday, and everyone is saying that LATG is the way to go for this records keeping. And yes, let's see, that was Wednesday. Yesterday I had a meeting in Rochester for the radio group, and they're looking at doing a group that does recording of the radio conversations at this whole thing, looking at getting this going where radio conversations would be recorded. And if I'm right, Scott, Houston County wants to be a part of it now?
That's a stretch.
Oh, okay, that was what they said.
That's hopeful thinking on their part. We're having some issues with our current, almost new system.
Okay.
And it may actually be cheaper for us to abandon what we have and join a regional,
Okay.
which wasn't an option 4 years ago.
Okay.
So
And then
we're analyzing that.
They talked about the 3 ECHO program coming into each county and doing an emergency response thing, and it's all provided by grants.
Yep.
So it's all good stuff happening. And I think that was it.
I had lots of meetings last week. I did go to the CJC one to hear about the record management, which was fascinating. We were there 2 hours and we didn't even get to the demonstration part. But it is, it's a good thing. It's all over the state. So anyway, do check it out before next week. And then at 3 o'clock, I had a family collaborative meeting, and that one is one that Linda from Human Services and Mary from Public Health basically organized. And it's between the 4 school districts. SEMCAC was there, Hiawatha Ed, Child Corrections wasn't there, or Corrections wasn't there because of vacations, and then the county, of course. Human Services, Public Health. It was very good because there is a fund of money, and this group hasn't met since 2011. And they can use it for, basically for services in each school district. And it's based on what the population of the school. So it was kind of interesting because Houston, of course, has a 400 in the school, but they have 2,500 that are online school. But it really only covers the people in Houston County from what we understood last week. We're still checking it. Otherwise, if you go all over the state, and it's really the money in this county, received from the state. So that was a very good meeting, and we're going to meet again soon because everybody's excited about it when there's money available. Then I had EMS up at Rochester, and there wasn't a lot new in that meeting. They're doing a lot of education, as you know, CPRs, really. And workforce development followed that. Again, wrapping up their year. And then on Monday, I had a Fraxan study group, which was a 15-minute meeting, basically, because of lack of quorum. I think that was it. Were you blinking? There's up my eyes.
That's what I was just going to say.
Okay. Since we're still a few minutes ahead, let's approve the claims, human services, and license center.
I'll make a motion to approve claims, human services, and license center disbursements.
Second?
All in favor?
Aye.
Tonight, there is a Board of Equalization meeting at 6 o'clock, right here in this room. And department head meeting is next week. Steve and Teresa. All right, Linda, would you and your human service team would like to talk? Good evening.
Morning.
Good morning.
Should I go first? Okay. What I have here is pretty light fare compared to what some of the other ones are going to talk about, but that's fine, that's the way it is. I'll follow up on Teresa talking about the local collaborative time study meeting. And actually, it really went very well. It was our first organizational meeting since 2011, May of 2011, so it's been a while. The priorities of the local collaborative are, and by local, they do mean just Houston County. And that is getting clarified, but I'm pretty sure that it's just Houston County, because the other counties in the state all have local collaborative time studies as well. So our priorities are just Houston County, and then along with that, it's to target children's mental health, and it's children in birth to 5 years old. And children's mental health can go up to how old? 21, yeah. So, and mainly what's gone on in the past is the money does get divided up based on population of pupils within each of the school districts. And a lot of what the school districts have done is hired social workers to then tend to the needs of the kids who need that help. I forget which school it was. I think it might have been La Crescent actually targets some of their funds to gifted and talented kids, which I thought was nice. But we talked just a little bit about where the money has been going. Interestingly enough, Spring Grove and Houston schools have not been turning in bills, therefore have not been using any of the funds, which it's kind of like, wow, they're there and they're not using them, but I don't know.
They have a new superintendent though too, and
Yeah,
I didn't even know about it.
Oh, yeah, I know it. So it's like, you know, and when you have turnover of help like that, it's hard. So, yeah, you lose some of the history. But anyway, we are up and running. We're working on an end of July date. We'll meet again. And at that one, we will finish up probably our bylaws and our governing. There is all of that in place, however, it's pretty old. So we'll look at what that is, we'll review it. I did give out draft copies to the people who attended, and hopefully that helps. They do their homework and they come back with ideas. So, other than that, I need to thank Mary Marshall because she gave us a real nice 23-minute movie that came from Beltrami County. They had spent quite a bit of money, Beltrami had on. It's kind of a motivational movie. It's called Celebrating What's Right with the World. And it had 6 key concepts, which it's really all about, kind of about attitude, that kind of thing. So it's believe it and you'll see it, recognize abundance, look for possibilities. It was nice, and so we did voluntarily pizza and a movie with our staff, and we bought pizza and the staff, you know, that's a motivator to have some pizza, but it was a nice movie. It was only 23 minutes. No one had to go unless they really wanted to, and I think we had almost everybody there. So that was a nice thing to do. And the other thing I have is Thursday this week, we do have a guest speaker here at the county, and that's open to everybody. And really, it's a very nice message. This guy is bringing it. Talked to him on the phone. I think it's going to be really very good. It's bouncing back in the face of adversity, and it is offered to the entire county. Human Services has our own session right away at 9 o'clock in the morning. That's just for our big group, because we have a big group. And then there are more sessions throughout the day. And I think I sent an email out if you want to look back at that, and you can look at times and everything. There is one at the end of the day just for supervisors, and if you're going to go to that one, you probably want to go to the employee one first, so you would end up attending two. But it's very worthwhile, and everybody, you know, on a work level here and on a personal level, we all have a lot of things we need to bounce back from, and we need to, anyway, I think the guy has a neat message. It would be good. The talks are only 1 hour long, so it's only 1 hour, and that's nice. Other than that, our county budget is very much on track, and I'm not going to talk a lot about budget today. I will wait till June is over, and then we'll have a full half of a year. It just seems a little more sensible to see how the first half has gone than 5 months. We'll just have more data. It'll be a little more accurate. And on a regional level, with my directors, we met last Friday. A couple things are still in the works. We, quite a while back, talked about having a regional adoption worker because it is a very specialized thing. We don't have as many adoptions as we had 2 or 3 years ago. I want to say it was either 2010 or 2011, we had 9 adoptions in 1 year, and then we had a couple more just the very next year. So we had like 11 adoptions in the works at one time, which is a lot for a small county. We have, what have we had this year? Two adoptions, which is more normal, more regular, but kind of like Wabasha County, I think they have, I don't know how many they have going on. So anyway, this adoption worker having a regional one is a nice idea because they keep changing the rules, and they are very specialized, and there's a lot of rules and a lot of paperwork. The other thing they're talking about that's kind of been resurrected, it kind of dropped for a while, but they brought back up again to have a regional trainer. Winona County was going to sponsor that, and actually it kind of died on the vine up there for various reasons, but they're talking about this regional worker or trainer being savvy in SSIS, which is the social worker software, as well as MNsure and all these, you know, income maintenance programs, and I'm kind of going, wow, that's a super person. Good luck finding that person. So we'll see how that goes. I'm not sure if there's a need. At one point in time there was, so that one's just in the works. That's pretty much my update, other than, what else do I have here? That's probably about it. I think I'm going to have these two talk about the legislative updates a little bit. It's pretty vague, and there aren't a lot of them, but they are the experts in their program, so.
Yes, I'll go. A couple things that we're working on. Overall, as a unit, one of the things that we're doing is creating practice models. So every program that we have, whether it's child protection, adult protection commitments, is now going to have an outline practice model of how we operate, looking at creating some consistency and continuity of how we do things and some accountability for the workers. And it gives direction. I think one of the things that workers will often say is when they're stuck, they like something to fall back on, something to look at. And so that's all getting developed. We have about 4 right now that are done, and we keep pushing along with the rest of them. If you want a copy or if you want to see anything, let me know. I will email you a copy of what that looks like. In the children's world, I met with Lerone Greer yesterday, or Friday, excuse me, in regards to some of the legislative changes as far as children's mental health is concerned. Not a whole lot in 2014 for children's mental health changes. There are, with 2015 coming up, there's some significant changes that might be occurring. One of them is that they're looking at restricting inpatient facilities for youth that go into care. So your residential placements are looking at trying to get rid of that a little bit, restructuring, and putting more effort and more money into intensive foster homes. They're changing the training structure, Rule 79, which is a mandated training session for new workers. They're looking at doing 5 sites throughout the state, and then moving training around as needed to those 5 regions. Not sure what those are going to be yet, but that's one of the changes for 2015. Changing, and this is kind of the big one that's going to come across and impact us, is our TCM, or the funds we get back from the state in regards to our targeted case management time. They're looking at restructuring that because right now there's a huge disparity between what Houston County would get, for example, as to what Hennepin or Olmsted would get. Big disparity. We get 300 something hit, they're up over $1,000, for visits. And so they're not sure what that's going to look like yet. There's really 3 options. One is to kind of save it the way it is and then maybe do a cap. Another one is to start looking at a tiered system on how it's going to operate. And then kind of the third one is looking at limiting possibly caseload sizes. You are basically going to have to take, and the number that was thrown out, and it's just a suggestion at this point, is 15. Small counties are going to oppose that, myself included. We've run at 20 plus. Even our new hire, thankfully, has already got 14 to 16, and she just started. I mean, we're going to operate high. We run lean, so for them to put that stipulation of 15 cases on there, really difficult for us to manage. Again, they're going to try to tag that with funding. Don't know what it's going to look like. Look like it's on the agenda for 2015 for legislation. They're working on it at different work groups up there. So
Tim, they're leading with funding. So what you're saying is there might be possible funding to add somebody if they're leaving at 15?
Potentially. What they would look like, or what it would look like, is they're going to put a limit on the number of cases you can have, and then the closer you get to that, the more money you're going to receive. The lower the caseload, the more funds you're going to get. It was what it sounded like from their own. Again, this is just kind of in its infancy at this point at the state level, and then they're also going to try to link some of the children's mental health world with the disability services world. Again, don't know what that's going to look like either. I'm guessing there'll be additional training that we're going to have to do, would be my guess at this point. So that's all for children's mental health. For child protection, we're looking at trying to orchestrate kind of a child protection and services workshop with judge, attorneys, prosecutors, defending attorneys, things like that, to kind of get everybody on the same page and kind of how we move forward with placement cases that go to court at this point in time. I threw a date out, but as you know, with that many people, scheduling is kind of an issue. So we're hoping, I would like to have that done in July at this point. So kind of moving forward with that. With placements and things like that, since it really is, when you look at costs at county, child placements is the one that's basically county funds. I mean, there's not a whole lot of recruitment for that. But we're still working on a couple different things. One, we're going to start doing town preservation meetings. And I also threw this out because when you look at our costs, you also have probation placement costs in there. And so even though it's a completely different world, we kind of pay the bill. And so I'm putting this out to them too, to come in and review any child that goes in care before they go in. Have a family come in, have a team of people here that will review that and maybe offer some suggestions or other ways to keep children in the community longer or inevitably forever. I mean, hopefully to not have an placement at all would be the outcome that we'd like to see. With that and with case planning and prevention, I am putting 2 workers up to what's called family group decision-making meetings. Most every other county has this already, something we haven't done. The training is free through DHS. And so you go in and what you do is you involve families in all of your case plans and your case plans. So it's facilitated by an objective facilitator. You come in, you work, you create a case plan or a safety plan with families to kind of move forward or to return kids and transition kids home. There's a lot of different ways this is used. They'll offer us some flexibility to do our case planning in conferences.
That's really a good idea.
Yeah, I've applied one already because I am trained, and it works.
It really does.
It's one of the better things that we can offer for families, and it really is empowered for families to do what they need to do to take care of children and things like that. So that's kind of the kids' world. The adult world, commitments of the group again, and honestly, we're not committing, or we're not the impetus for commitment. Hospitals, things like that. These are warranted. I mean, these are adults with active psychosis, things like that that are really coming up, and for whatever reason, this year's been heavy with them. We're looking at about 11 right now already, and it's a very high number for a small county. And so these are adults that end up in placement or in hospitals or regional treatment centers at this point committed by the court. And so we're going to start looking at some of that financial impact of what that's going to look like. We have some adult mental health grants that have been really eaten up because of these placement costs and the costs of what's going on at this point. So we're going to start looking at past years and try to do some comparisons to see what that impact is going to look like for 2014 and possibly 2015 at this point. So that being said, potentially a positive note, we are going to kick off Mid Choices, which is going to be an assessment tool for individuals with disabilities. The potential for good here is that we actually can recoup more of our federal and state money by doing these assessments and moving that. As we said, the assessments are very long. They take up a lot of social work time, but kind of with what we have, I think we'll be able to kind of handle that influx of assessment time without. I know we don't want to add like 2 people, things like that. I think we'll be able to handle what we have at this point moving forward, I hope, and then recoup some additional funds with that. Kickoff date is September. It was supposed to be March. They push it back. I'm pretty confident now that since we're doing the orientation, we're doing the trainings, that the state's letting us do them. We'll be kicking out probably in September. And then another regional thing I've been working on quite a bit is our strategic planning to look at how we allocate our adult mental health funds. There's a group of about 5 or 6 of us that are doing this throughout the region, 12 counties. And we're coming up with a strategic plan of what that's going to look like moving forward. It's a 3-year plan, really focusing on access to services, outreach and education, and then the income functioning of what's called CRESS, which is the Adult Mental Health Initiative Funds. It's been a long process, but hopefully our last session, our strategic plan, should be done at the end of this month and go to the director's thing. So that'll give us some direction and create some continuity with how we spend our adult mental health funds moving forward, and basically what funds we can access to the county too. So it'll be good. That's about what I have.
All right, I'll just break it down into the child support and financial world. Right now in the child support office, we are, with EDMS, we're almost finished with our scanning. We need to be done by July 1st. On Monday, we go to Winona and start our quality assurance testing for our process. So the workers will be able to get into the system and actually put cases in, so they'll scan them in, see how it goes into workflow, how it moves through that system. So this will be their first chance to really get in and play in that system. So we'll be in Winona on Monday. Tuesday, Data Bank will be down here to provide additional support, and then hopefully on Wednesday we can sign off on the system, and we are set to go live on July 9th. So Data Bank will be back here July 9th, 10th, 11th, that following Monday, and then another support day. So we will be in the paperless world shortly with the child support unit, which is okay. They have a lot going on right now with high school graduations. They work on emancipations, so as children turn 18, they're closing quite a few cases, so they're very busy that way. There were some legislative updates that happened. The biggest is with minimum wage increasing to $8 an hour August 1st. It does have an impact on how they will do their jobs. Right now, the minimum order for somebody who has no income, or where it's at 0, is $89. This change will increase the minimum order to $212. So that's a pretty big jump when you're looking at somebody who has very minimal income. So they're going to be having to work with that. And I did print off, because they can deviate sometimes from how they set their orders, and I don't want to go too into detail because this isn't my forte, but this is the policy that they have to follow when setting or looking at deviating from policies. So it'll be interesting to see the direction we get from the state as far as that goes. The other was, there was a case that I believe was out of Olmsted County where we did get some language changed. There was some non-custodial parent who had a very large arrears balance, and our language used to say if you provided care and support, then you were in compliance. Well, because the non-custodial parent did take care of the children, the county lost their case and dad didn't have to pay the arrears. So they did update some language that states if they are guilty of a crime of non-support, and they can show that they did it knowingly, willingly then. So they did get some language changed, which was a good thing to happen. Otherwise, just some little things with the child support, nothing real big right there. So, but they're busy. So, and then on the financial assistance side, our big thing we did have posted for a position that closed a few weeks ago. There is the test this Friday. We have there's between 20 and 30 people that will be testing, which is the merit test. So hopefully we'll have those results back in the next week or so. It's a lengthy process when we look at hiring. So I'm hoping by the beginning of August we can have a new worker in place and start the training process. There's a 2-year learning curve, and with all the changes that are coming down now, I think we're all still in that learning curve at this point in time. So that's the big thing there. We are looking at doing, the state just hired somebody new. Our Maxis, which is the system we work in, is old. It's DOS-based, it's green screened. People look at it and are like, wow. But it works, and there's somebody that has coded it, so a lot of our case noting is done automatically. It scans the system and it'll write our case notes. So we're looking at accuracy. It will really improve accuracy. Case notes documentation will all be standardized. So hopefully 80 of the 87 counties and the 2 tribes, if you go in and look for information, it'll all be the same. It'll go in and update certain things. It'll set us our reminders, because a lot of the work we do it now and then have to wait for responses back. It's amazing, so I'm hoping to have that up and running shortly too. Just with being short-staffed and everything that's going on.
Is that linked statewide? Like if somebody had an issue, they could pull records and it would be from some other county?
It depends. We can read case notes.
Yeah, not all of them.
Everything, yeah, we just can't go in and work.
Sure.
There are some cases that are privileged, children that are in foster care adoption system.
Sure.
There are cases that only certain people can see, but yeah, for the most part, we can.
So if somebody moved or something, it's not a big deal to transfer record?
And especially within our 5 counties that are EDMS, it's really easy because they're all right there. So, but this is, it's as simple as you push a button and you say okay, and it's amazing to watch it work. What takes us 10 minutes takes the computer 2. So it's a nice thing. Yeah, it's crazy. But they're getting, we're in Region 10, we're on the very beginning of this. In Oka County, that's where the worker was, has had this for 3 years, and it just got leaked out now. And the state did just hire, her name is Veronica Carey, they just hired her, and so she's rolling it out to the whole state. But she just finally updated. Otherwise, we had to go through 104 records because they're scripts. And it's all DOS-based, so she wrote all this code, and you had to go into 104 scripts and update Houston County, change all that data. Well, she just created another one that will do that all for us. So, perfect time. So I figure we'll get that done and on board here. Legislative updates, I've kind of scanned through these. A lot of them are really vague. The biggest thing I can't wait to see is they're talking about standardizing processes, and they've got some really nice things on income and assets, household comp, and other things. Because every program we have, we look at them differently. So even when we look at MNsure and healthcare that we do old school, they're all different. So between food, healthcare, the cash programs, we look at assets differently, we look at income differently, we look at household composition differently. So we've been waiting for this standardization for a really long time. So hopefully that'll turn out. And then it looks like they've done some things with MFIP, which is the Family Cash Program. They are going to allow education to be, so if there's an adult that needs a GED or to go back and get a diploma or basic education, that will be an approved work activity now, which is a very smart thing. People need that GED. It really helps when you're trying to get somebody employed gainfully. And just some other basic things that I'm interested to see what will be coming down the road for us. We talk change all the time, and that's really what we do. But right now, with Minsure and everything, it's even more than before, so. And Minsure, we are still working with that. Every week a new policy comes out, a new procedure comes out, and it's 5 pages that we have to follow, so it's not easy. You have to go step by step, and if you make a mistake in one step, then you kind of have to go back and recreate the wheel. So we're trying to balance Minsure and healthcare worlds right now, and it has really added extra work.
It's going to get better.
Scripts is my little sunshine rainbow, so we can get that running. But yeah, it will get better. Minsure is getting better all the time. You know, I know for consumers to use and be able to go in. We're waiting on our end for that to come to full fruition where it works. We're doing a lot of cleanup in the system, pushing a lot of cases through because cases still get stuck. So our workers are still doing workarounds and fixes to get things pushed through. And the big thing we have now is some individuals can get retroactive coverage. So if somebody applies in March and they had a medical bill in January, that's the information we're just going to be getting hopefully this week. We got a draft on that because we've had people that, you know, if they've had a major health incident and they need coverage, we haven't been able to help them or do anything as far as getting coverage open for them. So keep your fingers crossed. We just had to approve a draft yesterday, so we're hoping by the end of the week because we have probably 15 or 20 cases sitting right now that they're just sitting because we didn't have the functionality to be able to do anything with them. So.
You can say Minsure a lot better than you could 3 months ago. You go a different Minsure.
I've been talking, I'm not going to talk Minsure one of these days because I've been talking Minsure for I think a year.
But it's getting better.
It will be. Yeah.
Doctors call it Minsure.
So, and they did hire Deloitte, a company, to come in and help with some of the technical fixes because there are some pretty big technical things that are not right. We can't close cases in Minsure because the functionality wasn't set up. So they're working through all of that. They're new fixes and all the time. So.
Are the ambassadors, wasn't that with Minsure that they have the ambassadors?
They still have ambassadors, and we did just have on last Wednesday, the 11th, they did have a navigator come down through to help get people enrolled. You know, the hard part, we have trainings once a month, and we have a mentor now that does phone conferences and then has virtual lead training. So they're trying. It's just when you're trying to roll out the system to 8,000 workers or 2,000, however many are in the state, it's a difficult task to do. And it's all we're getting
Thank you.
Anyone have any questions?
Good report. You hardly have a thing to do, right, Tim?
Not a whole lot going on,
Tim,
no.
are you going to CJC tomorrow? And then doing that training after or during?
After. Yeah.
I'm going to be there for both CJC and that training.
2 and 5 are the training times.
Okay, I had 1 and 5 down, that's why
No, I have 2, so I'll be
Okay.
there too.
All right,
I'm doing it.
okay, see you then.
Tess?
Good morning, Commissioners. Just have a very brief agenda with you this morning. We're here to request the hire of Bonnie Felton, who's a former employee, as a 67-day employee to fill in as a case AB22 at an hourly rate of $14.19 an hour. Please disregard the effective date after August 1. It will be effective as they need them from here forward. This is to fill in for an individual who will be out on an extended leave. And I understand there's some training. Even though Bonnie has performed these duties in the past, there's some training that she needs to be updated. That is next month. And Erin has, you want to speak?
Sure. We just wanted to be able, we won't need her hopefully full-time until August, but with our EDMS system, we'd like to be able to have her go to the end user training so that she is very familiar. I mean, it'll be new for everybody, so if she can at least come in and see how the system works. And then we would have her set up to come in a few days just to reacclimate and get used to the systems and being in and seeing how the workflow goes. So,
Was she a 67-day employee the last time?
Yeah, I'm sorry. Last year she was for the front desk.
But she was previously, she's a retiree.
So this is her old position. She was the QC before she retired. And then she, when we had a gap at our front desk, seems so long ago. Yeah, she even helped out at the front desk until we could get in higher.
And I really appreciate the fact that she makes herself available because this is very efficient use of our tax dollars as the training period is minimal. So we're able to get maximum
Sounds good. I'll move
return on.
hire Bonnie Felton, 67-day employee for human services. No second.
Further discussion, all in favor?
Aye.
Opposed?
And I would note the rate that she's hired at is the rate all other 67-day employees in this position would be hired at. So it's not a preferred rate. Thank you so much. I do have a call in, just briefly, I have a call in, or an email in, I should say, to Jerry Conway, and I have invited him, commissioners, and to bring with him the engineer if they would, and ask for dates, he'd be available so we can get Jerry on your calendar, that folks here to answer your questions. Don't, it's the 17th today, and I said they would have the information back around the middle of the month, so I'm still waiting for that information, but it should be forthcoming. He thought it'd be here fairly shortly. Last week in his communications, he thought there was about 40 more hours of work I think he said that had to be done or less. And I had John go over and check out the structure this morning, after last night's heavy rain, and all seems to be in order. We have fans, and I told him if we needed extra air handlers, to put extra air handlers down there, depending upon what he judged the need to be. So he's got that in handling that, and I sent you an email earlier about us operating on emergency power for this building, and I haven't heard if there's any problems. I know I've seen lights blink a couple of times, I think, but we seem to be doing fine. The problems with the city, not with anything that the county owns. And we have plenty of capacity to continue operating.
Are we running on emergency power right now?
Mm-hmm. Have been since approximately 2:30 a.m. Unless they've just recently switched it in the last few minutes.
Could have done the flip.
It just got shut off here on 9/20.
So it is, that was the last blink?
Yeah,
Okay.
the city actually got their problem fixed, so.
Thank you. So,
That's when the lights were.
yeah,
I thought it was my
I
eyes.
noticed that, but I wasn't sure what that was due to. So, do you have any other questions, or?
No, we're just waiting for that information, as soon as you get it. That's good.
When you get it, you're emailing it out to us right away, or are you need to present it to us?
No, my plan would be, of course, Commissioner, to email it to you, and then for them to, so that you have it, so that if you have questions about it, I'm hoping they do come.
Yeah, that's what we prefer.
I cannot force them to come, of course, and answer your questions, but I don't know any reason why they wouldn't come. But I don't know the composition of who that they would be at this point. And that would be dependent upon who they choose to bring with them.
Okay. So just keep us informed. We're anxiously awaiting.
Yeah. We all are, very much so. Thank you.
Real quick before you adjourn, thoughts as far as everything that's been going on with legal stuff? As far as having Jay just.
I
fill
got a
in what's
notice
going on?
from Jay yesterday that we do not need to be there,
Okay.
and it is next Monday.
Yeah, so do we need to
At
have,
10.
them, like, see if we can schedule an appointment, have them just kind of brief us or summarize this so we know what's going on?
Isn't he coming next week?
He's coming the next
Next
day.
week's ready,
Okay,
yeah.
he is still coming, okay.
Yeah. And if he lets us know, I'll let everybody know, right?
Yep, awesome, thanks.
So, and also we have a, that's in Winona in the morning. Yeah, for that, Brett.
Yeah.
And then 3 o'clock in the afternoon's in Wabasha about that, sand.
So, Wabasha or Rochester? I've heard
Wabasha.
both.
I think it's Wabasha.
Okay.
Doesn't make any difference. For me, I did ask Bill. I offered to send you a Dana if you wanted to go. Jay said he doesn't need anybody.
Oh, you.
I was just kidding.
Sounds good.
And EQB meeting tomorrow, but that's, Jay's going to be there for that too.
Move to adjourn.
Second.
All in favor?
Aye.
Aye.